My name is Genevieve and I'm a care coordinator with Catalytic Health Partners.
And tell me about your role. What do you do at Catalytic Health Partners?
So with Catalytic Health Partners, I'm a care coordinator. I'm a field care coordinator, so I go out into the field and see members. I help them with their social needs, anything that pertains to their living situation. I also assist the nurse practitioner, our field nurse practitioner, to identify any medical necessities or needs that the member might need.
Why is in-home health so important?
I think in-home health is important for members because many times they are not able to go into a clinic setting to see a provider. So I think that it's easier for them for basically medicine to come to them, the medical field, whether it be a nurse practitioner. I think they also feel, or at least what I've come across is that they feel that they are more comfortable in their home setting. And so they're more likely to be compliant, I guess I can say, with their medications, taking care of themselves, doing a little bit better, taking care of their health.
In the 6 months you've been here, tell me the approach of Catalytic Health Partners and how that's different in what you've done in the past.
So I worked in a clinic for over 17 years. So coming to work for Catalytic Health Partners was a big difference for me in the approach that I made with members. I was unsure of how to approach it because in a clinical setting, most of the time I just would take the information and hand it over to somebody, which would be the doctor or the provider, right? And in this situation now where I'm as a care coordinator, I kind of have to handle some of that stuff and delegate it. Is it something I'm going to take care of? Is it something that I have to hand over to the field nurse practitioner? Where do I got to get some help from? But the majority of what I do is me taking care of the situation. So that was something I had to get used to, but it is very rewarding for me because in the end, I'm able to help somebody. So that is the not that I didn't help anybody in the past, but it's just a different type of reward feeling.
The approach that Catalytic takes of dealing with social and behavioral and physical needs, tell me why you think it's important that all three of those belong together.
I think that they all belong together because the way I look at it is like a pyramid, If we're able to take care of somebody with their social needs, their behavioral and their mental are stable, because someone is not socially in a good situation or a good place, they tend to have behavioral issues, mental issues, then that leads to medical and health problems. So I think we as care coordinators are an important aspect, as well as the nurse practitioners, in making sure that members are stable socially in order for them to be stable mentally and behavioral.
Can you give me an example where you maybe addressed a social determinant or social need first and what that outcome was?
So, we face this every day. And every day it's something different. I have a great example. So today I have a member last minute, which it happens pretty often that we have members last minute needing a food box or something like that. Kind of trying to determine how am I going to handle this for this member, requesting help with a food box. And of course we don't want anybody to go without food. That's very important. So she has a gift card. First, she had asked me for a food box, and of course I couldn't do it because, we had a training. So I got her a lift. So we got her, and she's able to use the gift cards that were donated to her. So she has something to get food. She just needed the help with the ride because she doesn't have a vehicle. So we got that situated for her, and so she went and was able to get some food. And we're gonna get her back home so she can, feed her and her family. So We have that a lot, so that comes up a lot with our members needing last minute help, and that's okay. That's exactly what we're here for. We're here to support them and help them, and then ultimately in the end, provide them with the resource in the future so that they can become independent to help themselves as well.
Fantastic. Can you tell me what's the top 3 most rewarding things that you do?
So the most rewarding thing for me is that I'm able to go out into the community, because community is very important to me. Growing up, I always wanted to be part of the community and help, and then helping people every day, going into their home, seeing another aspect of life, and knowing that you can make a difference in that person's life. That's very rewarding for me. And then just seeing some people that are very sad and unhappy, and you going in to help them. At first, they don't really trust you, but once they open up to you and you let them know that you're there to help them and support them, they really open up, and that makes me feel good, because now I know I have someone's trust and confidence that they believe that I will help them. And a lot of people don't have that, especially people that are needing support. They don't feel that there's that out there, people to help them.
That's a great example. Is there someone that really comes to mind where they didn't trust that Catalytic was going to help them, and how did you overcome that? How did you build trust?
So when I first began with Catalytic Health Partner, I didn't have a team. It was me only. I was the team, right? So I had to build relationships, and then at the same time, me building those relationships, I had to introduce my nurse practitioner on my team, and let them know, this is who is going to be joining me. She's my team now. She's great. She's, she has all the knowledge that that can come with nurse practitioner, but a lot of them were not accepting. A lot of them, were like, I'm really used to you, So then she came on a couple of trips with me, and people got to know her, and people loved her. Like even some people that hadn't met her that were with me, that she was with when she was with me, but a lot of people liked her, and she's great, But it's hard to convince people that you're there to help, because you get a lot of members that say, are you here to investigate me? Are you here because Access sent you? Or things like that, So you have to prove to them in different ways that I'm here to help you. I'm not here to burden you. And once you get to know them, you sometimes have to get a little personal with them, and tell them a little bit about your life story and where you're coming from, and that you're really truly there to help. And a lot of people believe you. So, yeah.
So you've been in healthcare for a long time.
Oh yeah.
What's changed?
I mean, nothing's really changed. I mean, of course, different guidelines and stuff like that, but I think everywhere you go, I mean, you have a little bit of everything. You see a little bit of everything. I learn something new every day, all the time, So, and changes always, But I mean, the approach is, I think, as long as you approach somebody with compassion and kindness, they're very open to you, and I think that's where you begin that trust with members, is being compassionate and kind. That human kindness effect really goes a long way. I've learned a lot. I used to do psych, and I learned how to approach people with mental behavioral disorders when I didn't know how to do that. It was like a whole new ball field, for me. So I didn't know, but now I know, and so now putting that into play with what I do now, it's so much easier. But it's totally different from what I used to do.
That's good. How is technology playing a role in what you do?
So technology, I mean, when I worked in the clinic setting, I used to use the EMR system. I used to, in a sense now what we do is we use a lot of resources from the internet. We refer a lot of members out to different resources, different food banks, stuff like that. So the technology that we use for getting that it's at our hands, so that's great. A lot of members now have their own phones, so you can, and most of them are really good with their phones. So you just, they text us, I need help with this. Well, let me send you this link, follow this, do that, and then it's good with that. So the technology now is a lot better. Of course, back from 17 years ago, it's a lot better and easier to help communicate with members.
What do you wish health plans knew about the work that you do?
I wish they knew the true needs of a lot of people. I know that everything is kind of a textbook, people follow that textbook, but I wish they could go out and see how personable people really need. They need people in front of them to explain to them, for them to see what's really going on with the member, because, the healthcare plans, they get, say for instance, a request for a member to have a CT scan for whatever reason, and they can just simply say, this isn't enough, or, right? And it's denied. But if they see the member and what was really going on with them, then they can really say, you know what, they really do need that. So I just wish they would be more open, and not so fixed to the guidelines on things that need to be done for members. Members need medications. I know that there's guidelines when providers are looking at those things, requests that come through for them to approve, but they need to really see the bigger picture is what I feel like needs to be done.
Is that your role? Are you the bridge? Are you the eyes and the ears that can help close that gap?
I feel it. I do. I am kind of that for the nurse practitioner, for our office team, to see what's going on with that member truly, to give them the information, because our office team here, they're in the office and they do all the back end work, which is all of our paperwork, our prior auths. The nurse practitioner and myself are the ones that are firsthand see what's really going on with the member. Are they really suffering these illnesses? Is it really true what they're saying is going on? So yeah, we are firsthand who sees what's going on.
Good. Is there an experience where you think, wow, I just made a huge difference? I changed, I made improve somebody's life. This is going to make them better or help them achieve their goal. Is there an example like that?
I think we do this every day. We do. I feel we do. We get thanks and praise from members every day that we've touched them in the simplest ways. It can be for just being there, and everybody that I've worked with on my team has been very gracious about our services to them, little or big, it doesn't matter, but I've been blessed to have a good population of members that have been very nice and a lot of gratitude towards what we've done for them. So not one in specific, but everybody, all my members, and I think it goes across the board for all of our teams, that there's members that are truly appreciative of what we do, the work that we do. Of course, you have resistance from some people, but I think overall, it's just, there's not one particular, everybody every day is great to work with, and our members are, they're happy, and that's what matters most.
That's great. So one thing that people should know about you that maybe they don't know, or what drives you every day and what motivates you?
So, like I said, I've been in healthcare 17 years. Healthcare is my passion. Never was in it for money. I've always wanted to help people growing up. And I'm not a great public speaker. I've learned to be a public speaker. Believe me, at the beginning I was not great at all, but I've learned through the years, because I, had to do speeches and stuff. but I love healthcare. I love helping people. That's my passion, and sometimes I get in trouble for it because I do it too much. And so I was a soccer coach for 10 years, and my husband was a fight with him all the time because he's like, you're always on the field, you're always with your team. So that's something I had to give up just due to other family issues. But yeah, I enjoy helping and working with other people, especially youth, children. I love that. I like really working closely with them.
That's fantastic. So I ask everybody if they could be a superhero, who is it and why?
Oh, I'd be Wonder Woman. I'd be Wonder Woman. I can multitask like nobody's business. Yeah, I can do 4 or 5 things at one time. So I want to be Wonder Woman.